everybody. It is a pleasure to have you today in this session, which is very interesting as we tried to um, put research into practice and make a bridge between academia and policymaking. Uh, Today we have a very interesting panel of experts that are shaping the agenda in terms of in the field of social protection in various areas. Today, the topic of discussion would be to unpack social protection across the life cycle. Initially, we will have a session of almost an hour and a half in which three of our panelists will look at the different stages in the life cycle, looking at what are the vulnerabilities they're facing, and specifically those population groups at different stages in the life cycle. And we are later going to look at how can social protection respond to that, and how these researchers, key thinkers in this field, have, through their research, provided different recommendations for policy making from all over the world. That research has come. And as a second section of um, this course today, of this plenary session, we will bring to you a very novel approach to social protection, which will be on the application of behavioral science insights into social protection programming. So, without further ado, I want to introduce you first to Dr. Tia Palermo from UNICEF Innocenti, and her colleague, Mr. Frank Ochere, who's joining us today. Just for any questions, she will be leading the presentation from New York. Very kindly, she has joined us. Tia Palermo is a researcher and social policy specialist at UNICEF Office of Research, Innocenti in Florence, where she conducts research examining impacts of social protection, household and child well-being throughout a range of experimental and quasi-experimental designs as part of this transfer project, an initiative which brings together UNICEF, FAO, and the University of North Carolina in a unique effort to help African governments create better policies and programs by undertaking long-term multi-country impact evaluation research on social cash transfers. I would like also to introduce you to Frank Ochere is a researcher as well and social policy specialist at UNICEF Office of Research. His current work involves research examining the impacts of social protection programs on household and child well-being. We also have today, and I have the great pleasure as well as introducing Tia, to introduce Professor Maxine Molyneux, who, after the explanation of Tia Palermo, will, looking at the life cycle, or the stage in the life cycle that goes from birth to childhood and adolescence, Professor Molyneux is going to look at adult age, and specifically is going to provide us with a gender analysis of different outcomes at the productive age, and how does gender inequalities mediate in the capacity of women to undertake an insertion in the labor market and take benefit from social protection interventions. Professor Molyneux is a professor of sociology and former director of the Institute of the Americas at University College of London. She has written widely in the fields of gender studies, human rights, poverty, and development policy, and she has authored books on Latin America, Ethiopia, and South Yemen. She has served as senior consultant to various UN agencies, and we're very pleased to have her with us today. At the same time, we have today my colleague, Charles Knox-Vydmanov, who is the program officer for social protection within the social protection governance and tripartism team here at the ITC-ILO. Charles is an expert on old age and pensions. So after we've seen um, the birth, childhood, and adolescent stage, very well covered by UNICEF Innocenti, when Maxine has told us and help us to navigate the working age, adulthood, Charles is going to talk to us about that stage of when we are old and what are the specific vulnerabilities that are there and how the social protection respond to that. When we close the cycle, in which I hope you will be very lively and asking lots of questions, we will have a very interesting presentation, very novel, from New York, from a think tank called Ideas 42. We have Mr. Josh Martin, who, as I said, is very much challenging a bit of the thinking that we assume of the basic assumptions we have. So Josh Martin is a vice president at Ideas 42, responsible for overseeing behavioral science intervention programs in diverse fields, from domestic financial aid reform to international livelihoods programs. Prior to joining Ideas 42, Josh was a policy advisor in Côte d'Ivoire, Ministry of Planning and Development, and studied policy at Harvard University, Kennedy School. So without further ado, I would like to give the floor to Tia. So we will see her presentation. You will be able to see her in the main screen with her presentation in English. And in the sides, you will be able to see the presentation in French as it advances. Thank you very much.
Thank you. Can you hear me okay?
Yes, we hear you.
So good afternoon. I'm very sorry that I can't join you in person, but I'm very grateful to be able to join you remotely. And I'll be talking about work that we're doing at UNICEF together with the Transfer Project. Our mission at UNICEF is to promote the rights of every child. And drawing from that, we focus at UNICEF on supporting nationally led inclusive social protection systems, which aim to remove the economic and social barriers to promote equitable outcomes. We also work very actively promoting linkages between social protection and other multi-sector outcomes. In this work, we focus broadly on 4 areas, including social transfers, ensuring access to services, social support and care, and finally on legislative and policy reform. And these policy and legislative reforms may relate to removing inequalities in access to services, livelihoods, and economic opportunities. Now, social protection, as you have been discussing today, both responds to vulnerabilities, but also aims to prevent future vulnerabilities. And social protection can be protective, preventive, or transformative. Protective forms of social protection include those that help families and households to cope with their existing vulnerabilities, which may be related to poverty, shocks, etc. Those measures that are preventive help households prepare to weather future shocks. So those may include insurance schemes, but they also may include other forms of social protection, such as cash transfers, to the extent that those programs are able to allow households to increase their resilience to weather future shocks. And finally, transformative forms of social protection are those that result in increases in equity and a reduction in social exclusion. And they do that by addressing some of the structural constraints that households face. As has already been mentioned, on this panel, we're focusing on a life cycle approach. And this slide breaks down some of those different stages of the life cycle in childhood. And this is by no means an exhaustive list, but it just serves to illustrate some of the different points of interest that social protection can try to address or facilitate linkages for other complementary services within the different life cycles in childhood. So first we have birth, and some of the key outcomes that we can be aiming to address in birth include birth registration, pre and postnatal care, health insurance linkages, and nutrition. In early childhood, moving on, many of the programs that we've been discussing focus on preventive health checkups, enrollment in schools, nutrition also, and increasingly they're looking to complementary measures and programming that can prevent violence. And finally, in adolescence, again, programs focus on education. There's also been a lot of interest trying to understand whether social protection programming can delay pregnancy, prevent HIV, delay marriage, and also protect adolescents from hazardous forms of labor and from violence as well. Now, there's a lot of research that has focused on early childhood development, and we see that programs have been able to reduce infant mortality in some settings, though these do not always replicate to other settings. We also see that there have been decreases in morbidity. So for example, many cash transfer programs have been successful in reducing incidents and days where children are reporting respiratory problems, diarrhea, etc. We have also seen, related to the birth access points, we see that there have been increases in antenatal care, skilled delivery at birth, and reduced infant mortality, as I mentioned previously. We also see that conditional cash transfers have been successful in increasing the uptake of preventive care services. And in early childhood, we see that programs such as cash transfers can also be successful in increasing cognitive skills. So all of these are different types of impacts that we've seen that cash transfers and related social protection programs can have at the different life cycle. And there's been a lot of focus so far on looking at these outcomes related to birth and early childhood development. Increasingly, there's more attention being paid to adolescence, but still less so perhaps than some of the early childhood outcomes. And one outcome that we've mentioned here is nutrition. And what we've seen, largely from the cash transfer literature, is that cash transfers are able to affect many of the key pathway outcomes related to nutrition. So they increase household food consumption, they increase food security, and many of the pathway indicators along nutrition. However, cash transfers alone have proven very complicated to affect nutrition on their own. So there have been a limited number of studies that have found impacts on height for age and little to no impacts on weight for height. And for weight for age, we see mostly among subgroups only. So what this is suggesting is that for cash transfer programs to have impacts on nutritional outcomes and anthropometric status, such as stunting, it's really key to be able to combine those cash transfer programs that are being successful in impacting many of the outcomes along the pathway and really linking those up to complementary services in an integrated or a cash plus approach. So for the rest of the presentation, I'd like to focus on an area that has been relatively more neglected, and that is the adolescent phase of the life cycle approach. And the evidence that we have on education and child labor has been informed by the theory that suggests that as households have become less economically insecure, that they will enroll their children in education in school, and this will have a positive impact on school enrollment. But there are also some ambiguous effects simultaneously on child labor. So just because we see that children are enrolling in school, this doesn't mean that there will be a similar negative impact on child labor. So that effect is somewhat ambiguous. So as households are becoming strengthened on the economic front, they're investing in agriculture, livestock, economic activities, children may be pulled into those activities to support the household. And what we see from reviews of the evidence is that there are positive, strong impacts on school enrollment, both for conditional cash transfers and also for unconditional cash transfers. So both of them are positively increasing enrollment in school. However, when it comes to child labor impacts, we see somewhat mixed effects. So conditional cash transfer programs are more likely to reduce child labor compared to other programs such as unconditional cash transfers, labor market programs, and microcredit. So there is a growing body of evidence on this, and there have been recent reviews. However, there are still some gaps in understanding how cash transfers and related social protection programs impact the worst forms of child labor. So we know that sometimes there can be simultaneously increases both in school attendance, but also in participation of agricultural activities or livestock herding for the household, etc. We don't know very much about what are the long-term effects. We don't know if these programs are protective against the most hazardous forms of child labor and industries. And finally, we don't know a lot about the impacts of integrated programming, often referred to as Cash Plus, when they are focused around cash transfer programs and linked to other services. So that's a gap in the literature that's still being explored. Moving on to broader outcomes related to adolescence, there's been increasing interest in trying to understand whether or not cash transfers can facilitate safe transitions to adulthood. So many of the outcomes that are studied are not directly objectives of the programs. However, we know that many adverse outcomes in adolescence are driven by poverty and related vulnerabilities. So the idea is that if we strengthen the household economic status and reduce poverty at the household level, what effects does this have on adverse outcomes in adolescence that are driven by poverty? And we've seen that government cash transfer programs in sub-Saharan Africa in particular have had the ability to delay sexual debut, marriage, and childbearing. However, a key caveat is that these findings do not replicate in all settings. We've also seen some evidence that household poverty-targeted cash transfers can reduce risky sexual behaviors, which has implications for HIV and other related outcomes. We've also seen that cash transfers targeted to households can improve the mental health of adolescents living in those households. And in one case, a non-governmental cash transfer program targeted to adolescent girls and their caregivers was seen to reduce intimate partner violence among adolescents. So all of these are positive outcomes that suggest that cash transfers can facilitate safe transitions to adulthood. And this is important because it's important not only in adolescence to equip adolescents with the education and the skills they need to be productive adults, but they also need to be equipped with capacities related to health. And that's why safe transitions are so important. And these programs can have transformative potential, like we were talking about before, if they're able to reduce the gender disparities in secondary school enrollment, if they can challenge traditional attitudes about how girls are valued by their families and communities, and finally, if they're able to increase the capacities of individuals and also to increase their opportunities and their future economic inclusion as they transition to adulthood. So I mentioned before that many of these programs are household targeted anti-poverty programs, and they do not have these adolescent-related outcomes as their main objectives. So why should we worry about investing in adolescents through social protection? Well, it's important because adolescents are a key population to breaking the intergenerational cycle of poverty, and many of the social protection, particularly cash transfer programs, are focused on investing in human capital in an effort to help break that intergenerational cycle of poverty. And adolescents are a key population for that. So at the household level, those are the individuals who are transitioning into adulthood and are therefore key to breaking that intergenerational cycle of poverty. However, at the national level, adolescents are also key to economic growth, and that's related to what's known as the demographic dividend. Now, many sub-Saharan African countries are still going through this demographic transition, and many countries are still in that first phase of the transition where there's low mortality. Mortality is decreasing, whereas fertility is remaining high. And what this means is that eventually there's a one-time window of opportunity where there is a larger than normal share of working age adults as those who are currently adolescents are transitioning into adulthood. In this larger than normal working age share of the population can be converted into a one-time opportunity for economic growth. And what's required for this is to invest in adolescents' human capacity and also simultaneously invest in infrastructure, health and education systems that promote labor intensive. So this is kind of a two-pronged issue where in order to realize there has to be an investment at the individual and household level in human capital and also at the macro level. And specifically, adolescence is important because it is a period of rapid physiological and so adolescents are experiencing heightened exposure, reflected in some of the adverse outcomes we spoke about previously. And the transitions that are made have long-term impacts on their future health, their well-being, and their productivity as adults. And so key. And that's why oftentimes we hear about dividend. And that means that investments in adolescents can have an impact tomorrow as those adolescents become adults, and then in future generations as those individuals have children. Therefore, adolescence is a unique window of opportunity to enhance individual capabilities related to access to education and skills, and also, importantly, to improve opportunities which are often constrained by gender norms. So we've made the argument, hopefully you're convinced now that it's important to consider adolescents in social protection programming. So how are they currently represented? We've already talked about how they're traditionally not the primary focus of government-run social protection programs. Oftentimes there's a prioritization of early childhood development, which is also a key stage of development. However, in sub-Saharan Africa, a lot of these household-targeted programs are targeting large numbers of adolescents by nature of their targeting because they're targeting labor-constrained households. But the needs and the vulnerabilities of these adolescents are rarely reflected in the program design. And a gender lens in particular is rarely used for understanding exposure to risk and vulnerability. So a lot of the issues related to adolescence, including early marriage, violence, early pregnancy, sexual and reproductive health, remain sensitive issues and are not often directly addressed. And this, by ignoring some of these vulnerabilities, we are influencing the poverty trajectories of these adolescents. Programs that do focus on adolescents are typically run as pilots to address these overlapping vulnerabilities, and some of these can include examples such as cash transfers, educational stipends, fee waivers for services, in-kind transfers related to education. However, programs that are transformative will need to promote empowerment, voice and agency among adolescents. They also need to tackle harmful sociocultural practices and improve the strategic position of adolescents and individuals in their communities and families. Some examples of some innovative designs that we've seen around the world. So in Zambia, the ministry that implements the social cash transfer worked with the Ministry of Education to provide waivers for adolescent secondary school age girls in those households. We've seen individual entitlements for adolescent girls in India. And we've also seen that different countries have experimented with the size of the transfer and allocating higher amounts related to age and gender vulnerabilities. I wanted to talk briefly about one example of a Cash Plus program that's working within the Productive Social Safety Net in Tanzania, the government-run program, and it's attempting to address the unique gender and age-related vulnerabilities of adolescents by strengthening capacities among a number of dimensions. So it's focusing on livelihoods related to economic capital, educational capital, information, also social capital by building behavioral and life skills, peer support, and mentoring. And finally, it's addressing health capital by facilitating linkages to existing government health services and ensuring that those services are youth friendly. So in this way, this program is both strengthening the demand side and also the supply side and facilitating linkages between the two. And this is implemented through government structures by TASF, which implements the Productive Social Safety Net in Tanzania, with support by TACAIDS and UNICEF and other partners. So to conclude, it's important to mainstream an adolescent lens into programming. Social protection has large potential for adolescents in investing in their human capital and their capabilities, but it's important that we ensure their needs are explicitly reflected in programming. So this might mean making adjustments to existing programs, objectives, features, etc. And it requires oftentimes augmenting staff capacity and operational systems. Now, it's not to say that one social protection program needs to address all of the issues that adolescents face, but it's just important to recognize the interplay of all these factors and how age and gender-related vulnerabilities are playing out in some of these adverse outcomes. So where those programs specifically are targeting adolescents, more needs to be understood about their situation and consider their vulnerabilities, as well as facilitating access to the health and education services that they need. And finally, UNICEF is conducting a lot of work in support of universal child grants. We're developing a series of case studies, which is expected in early 2019, and we hope will be a useful resource on these topics. Thank you very much.
Okay, thank you, Tia, for such an interesting presentation. Now we would like to give the floor to Professor Maxine Molyneux, that, as I said, will talk now about adulthood and working age.
Hello, everybody. It's great to see so many people here, and also to know that we have people on our platform. Hello to all of you as well. I'm going to start with just a couple of questions, which we're going to put up here for you to give us your views. And there are two questions, Charles, which I think you should have. Here they come. So
they're about to get in.
We're going to get them in a minute.
Yes.
Okay, so this one doesn't work?
And you will move it like this.
That's to move it forward.
Yes.
It's the same for the
Yes.
presentation.
Yes.
Okay, everybody, so a few more to come. Great, so shall we have this? So we have, can cash transfer programs reduce gender inequality? And we can see an overwhelming response of 89% say yes, with a no in the region of about 11%. So that's very interesting. And the second question we're ready for now. Thank you, Charles. Should the daily care of children be the sole responsibility of women? Right, so we have 100% here, which is fantastic consensus. Okay, thanks everybody. So now I'll just start talking about my bit of the life cycle, which is to talk about adulthood, but I'm going to use this as an opportunity to focus on gender relations and look at how can social protection tackle women's poverty and vulnerability. Let's hope this works. It's not actually working. So I think we'll try this way. Yeah, this one's better. Yeah, okay. So gender I'm calling the absent present because it is everywhere. And of course, social protection, as we know and we heard this morning, has extended across the world. We have fantastic expansion of coverage in social protection in recent years. But what is striking is the lack of discussion about how to tackle gender discrimination, gender inequality within the context of discussions of social protection. And that's even more surprising because there has been recognition by the international development agencies that development projects often fail women in a number of ways. It's not working, sorry. Bear with me, we just have a little technical problem here. Okay. Going down or up? So going down. Okay. So one of the problems is that if you ignore gender, you can then get program failure. And indeed, the World Bank Group's independent evaluation group reported significant concerns about the effectiveness of the bank's approach to gender, referring to a box-ticking approach with no follow-up substance. And that has been more or less replicated in a number of other reports. So we really do need to think about how to incorporate a much sharper focus on gender within social protection. And one can start by making a few observations. First of all, very few social protection programs actually have gender as a focus or incorporate gender within the objectives or gender change or gender equality. And social protection, of course, is directed at the poorest and most vulnerable, but women and girls figure in this category disproportionately, so there should be more response to dealing with their specific needs. Female poverty, we know, is still very persistent despite social protection, and in some cases is actually growing. And gender and poverty are intimately linked, and yet are all too often treated as separate. Finally, program design and implementation are insufficiently gender sensitive very often. So let's think a little bit about why understanding gender matters. So when we think about gender inequality, we have to bear in mind that it results from structural disadvantages that affect men and women, but affect them differently. In the world of work, women have fewer income-generating opportunities, lower pay, lower incomes or no income. They do unpaid work very often. They have quite burdensome care responsibilities. They suffer from discrimination, from sexual risk, from maternal risk, and of course from gender-based violence. Meanwhile, in the home, girls and women often suffer from hidden secondary poverty and less disposable time due to domestic divisions of labor and authority. Households are not income pooling units, but loci of unequal power and status. The result is that women have less disposable income, accumulate fewer assets over a lifetime, and have fewer opportunities and life chances. Despite all this, their needs and risks are often overlooked in social protection. So why is that? First of all, I think household income, when you take that as a measure of poverty, does not tell us the whole story. It may bear no relation to women's poverty because women may not be able to access it. So for many women, it's their own capacity to command and allocate resources that's as important, if not more important, than the actual resource base in their households. And thirdly, poverty is as much about agency that is compromised by abuse, stress, fatigue, and voicelessness, as it is about simply the lack of resources. So, if we look again a little bit more attentively at the black box of the household, we need to open it up. And there's far too little research on household allocative mechanisms and indeed time use. And there's a growing body of material that shows this unequal distribution. And I have here a couple of examples from Mexico, Costa Rica, and Honduras, which shows that men may withhold up to 50% of their income from the household, and that women's expenditure, on the other hand, tends to be household and child-directed, and their leisure time is typically substantially less than men's. We also have to consider discriminatory gender norms, which are often at the heart of household poverty, and that prevents women and girls from gaining an education, accumulating assets, or generating an income. And these norms can also normalize intimate partner violence. In short, poverty is a gendered experience in that men and women are poor in different ways, to different degrees, and at different times in the life cycle. Gender is about power and powerlessness, and I have a couple of examples which I'm not going to read out because all of you can catch up with that later on when you see the PowerPoints. But certainly issues like intimate partner violence and so forth are well illustrated in qualitative research of the kind that I and others have done. So I shall pass on from these examples, but do catch up with them later, because one of the other issues I think we need to understand in terms of violence is that poverty and the stress of poverty obviously exacerbates violence. And also, as I said before, closes off opportunities for girls and women. And here again is another example which you can follow up later. Now, why is it that gender blindness persists in studies of poverty? And I think that's due to a lack of understanding of the fact that, you know, poverty is multidimensional. It is not solved simply by giving cash alone. There's also very kind of ingrained assumptions that women are the sole carers, that they have no economic roles, that they are available to do other kinds of things for the program concerned. And lastly, there's sometimes a very instrumental approach to social protection and to women, who are often treated as conduits of policy, as the vehicles for achieving policy goals. But this is a rather instrumental approach, but it's also an inconsistent one, because healthy, educated mothers are essential for children's well-being. And needless to say, women's poverty should be tackled in its own right. So it's not just a question of seeing women, but it's also understanding that gender is relational, that there are gender relations at play, and we can do this through adopting a gender analysis. Gender is, after all, a fundamental principle of social organization. It underpins asymmetries and inequalities, which then become naturalized and essentialized. They become taken for granted. And that obscures the ways in which gender inequality is reproduced through, for example, state actions or inactions, through law, through social policy, through discourse, through social norms, and institutions like the family, the labor market, social and economic policy, education, and so on. And of course, these effects are present across all classes, ethnic groups, and regions, but with very different effects. Women who suffer from ethnic or race discrimination are therefore subject to multiple deprivations and structural causes of poverty. And what we need to understand is that kind of complexity in the experience of women. Not all women undergo quite the same forms of discrimination, but all women undergo some forms. So in general, we've had, unfortunately, a lack of theoretical and analytic understanding of gender in development policy, and a lack, therefore, of proper attention to the conditions that make women poor. So I'm going to now talk a little bit about cash transfers, which will be perhaps the main or certainly an important form of offering social protection in many of the countries that you are familiar with. And I want to talk a little bit about the successes and limits. So first of all, to start with the plus points, and I think Pia also mentioned some of them, but we have to start by recognizing that non-contributory cash transfers to poor households have given millions of women a degree of income security, and that's been often for the first time. And although cash transfer programs are often designed to improve children's life chances, transfers are often given directly to mothers who also benefit from some of the other program add-ons, namely maternal and child health services. So there are, a number of ways, including in our research and in other research, we find that cash transfers definitely improve women's self-esteem, their well-being, and do, to a certain degree, although the evidence is mixed, they do tend to reduce conflict in households. So those are definitely good points. I'll get this right in the end. And of course, we have got other positive results of conditional and unconditional transfers, which I think Pia already summarized, particularly in regard to children, so I won't spend any time on those. But they do good things for women, but do they actually change gender relations? Do they actually promote equality? Are they, in other words, transformative and change things in a positive direction, or are they just palliative? That is to say, they help, but they more or less keep things as they are. Here I'm just going to reflect a little bit on some of the research that I have led, including this 5-country study, which we did with ODI, the Overseas Development Institute, for our Ministry of Social Development, DFID. And we did it in Mozambique, Uganda, Kenya, Yemen, occupied Palestine. And the work was looking at beneficiary perceptions of cash transfers, what was good about them, what the problems were, and so on and so forth. We found, along with other research, that there was very little evidence that cash transfers actually impacted on intra-household decision-making. There was very little evidence that it did. Cash transfers did not alter the balance of power or the division of labor in households, but where these programs were accompanied by relevant services, the cash plus model, the chance of more significant changes for women was far greater. However, unfortunately, the issues of discrimination and exclusion were not really tackled, or were simply not tackled effectively. And there certainly across the board was an insufficient attention to encouraging more gender-sensitive social accountability approaches, by which I mean complaints mechanisms by which beneficiaries could hold administrators and, the cash transfer program officials to account, or make complaints about exclusion errors or what have you. And we further found that there were difficulties for some women to participate in these mechanisms, particularly those in the least advantaged groups. So we can, however, think a little bit more creatively about how to bring about positive change in gender relations through program design. We know that giving women the transfer gives them a degree of independence in the spending of the stipend, of the cash, and that changing that behavior might also eventually change gender norms. We also know that if we give cash incentives, larger cash transfers to families with girls to boost school attendance, that also sends a positive message in communities that girls are valued. And there are a number of countries that have done this, and Pia mentioned some too. Also, if we make sure that we can reserve quotas on programs for girls and women and pay equal wages in income generation or work programs, we can also improve the messages around girls and women, and also give them a greater set of opportunities. We found too that lump sum payments to women in other parts of the world, for example, maternity grants, are very often spent on women's assets, and they're also sometimes gifted by mothers to daughters. The case in particular I have in mind is northeast Brazil, where the maternity grants were spent by women on cows, for example, and were sometimes given to the girls for their asset, for their later life. Also, of course, financial inclusion is a very important part of some programs, because some programs provide women with bank accounts so that they can manage their money better, and they can, if the transfers are high enough, they can also manage their own savings and therefore take control of some of those aspects of the domestic economy. But again, very mixed evidence on reducing interpersonal violence and interfamily violence, because that remains a little bit more difficult to get at, although there are some programs that are doing work on that. So another beneficiary story, which again you can catch up in, but I will just say this is quite an important point, because some of the most excluded groups that we interviewed in another research project, this was this time in Latin America, were the indigenous communities, who were the Amerindian peoples of Latin America in the Andes, who on all the kind of human development indicators are very badly served by policy. And we found that, that Latin American indigenous women were very interested in wanting to know more about how they could improve their lives once they got the cash transfer. And they felt very strongly influenced by the idea that they had rights, and that they could actually advocate for getting their rights respected by administrators, by the government. And they also felt quite strongly that they wanted to get these rights in order to not feel humiliated in the community. And also, of course, these programs are also able to change certain attitudes around how they might make something of their lives by using the cash, by getting involved in the program. So here we have the, I think, a very important kind of point to keep in mind, that whatever social protection programs do, they should do no harm. Social protection program design, unfortunately, can also reinforce unequal gender roles by reproducing discriminatory norms and practices, by treating women as exclusively responsible for caring, excluding men from parenting or health sessions, failing to respect women's income-generating responsibilities, assuming that women's time is free to meet burdensome conditionalities. Conditionalities are particularly present in Latin American programs, that people only get the transfer if they fulfill conditions such as making sure that their children attend clinics or school, but not much thought is sometimes given to how difficult it is for women to actually get to these places at the assigned time, and many have to travel long distances and wait for very many hours in very hot sun to actually fulfill their conditions and so forth, and that is a major problem. So in that sense, we come back to the point that programs should actually promote good values, look after people, respect people, and of course, particularly officials have to be trained to treat people with respect, not to discriminate against minorities, and so forth. So the other kind of point it sort of follows on in a way about discrimination and the Latin American example, because this was, again, quite a striking example that programs really needed to do much more around questions of not discriminating against very subordinated groups. And there was also kind of questions about, even in countries which had made efforts to incorporate legal reforms to address issues of rights, again, a serious lack of training around how you might treat these communities with respect, particularly in, for example, adopting culturally appropriate information and practices in areas such as, sensitive issues like women's health. These were identified by beneficiaries as, really really difficult problems for them, and led to them not participating in programs, feeling resentful, feeling badly treated. So instead of helping, in some cases, the programs were not helping, but rather reproducing some rather unfortunate and negative ways of behaving. So cash transfers then can be transformative if they're well designed. Today there is more understanding that they can be effective vehicles for accessing services, that they can provide ladders out of poverty, and we know what works. There's an accumulating body of evidence that skills training, financial exclusion, affordable or free childcare can make a huge difference to the life chances of beneficiaries. That in many cases community projects can work effectively to reduce gender-based violence, that if you give people the right information about their entitlements and rights, they will, avoid issues like exclusion and errors and so forth, and also the importance of establishing really effective participatory mechanisms so that complaints and grievances can be properly responded to. And here I think I want to kind of emphasize that recent research has taken up this question of social accountability, of giving beneficiaries more voice and more presence within the various stages of design right through to implementation, so that those participants in these programs do acquire proper respect for their experience of these programs. And there's two kinds of cases to make for social accountability. I mean, one is that it's an intrinsic good, it's a democratic, ethical imperative. People have a right to a say over policies that are going to affect them after all. But there's also an efficiency case. Social accountability does promote effectiveness. It aligns program objectives with communities. It brings local knowledge into policy and practice, and it therefore is a counter to those top-down, one-size-fits-all policies that we know often don't align well with communities. And just a few examples of social accountability and social protection. We have project level, which I'm sure many of you are familiar with. That is to say, participatory monitoring and evaluation, where you're asking for direct responses from people. But there are other techniques being developed, like community scorecards or effective means of complaints monitoring using, for example, anonymous phone-ins and the like. And of course, in some cases, programs have citizens groups representation, so they can get together, talk among themselves, and make demands for improvements of services. And finally, very large-scale rollouts are to be found in the social audits, which are currently present in India and Pakistan and are being trialed in other parts of the world at the moment. So all of these we can talk about later, but they all have, some effect on bringing more participation into social protection. And of course, if you think about what might be the expected effects of social accountability, we expect some democratic outcomes, we expect some more effectiveness in policy and programming. We want more citizen empowerment, so people can, get together and understand their rights and understand that things can change. And above all, we want some state responsiveness. We want states to respond to some of these things. And if states hear more about what works and what doesn't work from the people themselves, the hope is that they will respond in time. Does it happen? Well, at the moment, we're still very much at the kind of beginning of research findings, but we'd have enough evidence to show that social accountability measures have helped to reduce corruption, have helped to improve service quality, and empower people, sometimes with citizen effects. So sometimes people do get together as citizens and move things forward. And there are several good studies of this, and the outcomes are relatively positive, although context-specific and highly variable. Just one quick example on that to illustrate it, something I saw for myself, so to speak, is that research on, again, very poor indigenous women in Mexico and in the Andean region of Latin America showed that quite a lot of very poor treatment of beneficiaries, people would turn up and the clinics would be closed, long queues, bad behavior by officials, but that did change after they were made aware of their rights and demanded respectful treatment. And you also found that people were less thanking the government, the president, for the transfer, personalizing it to saying, no, it's my right. It's not a favor. I shouldn't be grateful to the president for this. This is a right. But again, we see some big gaps, and certainly our research in Yemen showed that the Akhdam community, who are a caste of very poor people, were routinely excluded from the program, even though they complained. So there's a lot of work still to be done. So finally, to sort of wrap up, there are a whole number of policy lessons that we can draw from this. For women, marginal and discriminated groups, we do need more finely tuned, more targeted interventions. We need to improve and increase effective feedback, participation, consultation, to make these mechanisms trusted by the people who may use them, and more inclusive, of course. We need to work with men and boys to change attitudes. We can also create all-female spaces that would be vital to discussing difficult issues that girls and women are facing. And certainly we need to invest in more staff to manage social protection programs and do it properly. Training should be compulsory for staff in equality and non-discriminatory attitudes if it isn't there. And of course, a research plea, we do need more disaggregated data on the impacts of social protection. I won't go through all the conclusions here, but just to say that clearly social protection can be made more effective, it can be made more efficient, and it can be made more, equality responsive through improved design, although it does have a long way to go. And in some ways, we're seeing good responses, but insufficient still. And I hope that I've persuaded you that we can all do a bit better in this area. So thank you very much. That is the end.
Okay, many thanks, Maxine, and for giving us such a good account of the gender aspect of social protection. Right now, we will give the floor to Charles Knox, who is going to walk us through the old age and the vulnerabilities to which social protection must attend. So, your floor.
Thank you very much. Can I have a microphone? Roaming one. Okay. This one. Okay, good afternoon, everyone. It's a pleasure to be able to share a few thoughts on the issue of old age social protection, as Juan said. And I think a number of the themes that I'm going to discuss a little bit resonate quite a lot with the presentations already made by Maxine and Tia, so hopefully that will show something of a kind of cohesive story between the different presentations. So with this presentation, what I want to do is firstly unpack a little bit some of the issues associated with old age, and why we provide why we build social protection systems to protect people in their old age. But in doing so, I also want to unpack a little bit or use that as a way to understand, well, why do we build life cycle social protection systems? Which is really this idea, which I think was mentioned this morning, of rather than focusing on just trying to target the very poorest people in society, why we build a system, a kind of package of benefits addressing different life cycle risks, old age pensions, disability grants, child grants. So that's what I want to look at a little bit. But before starting, I'd like to just have a little poll, use the Slido again, to see your thoughts on a question, not that one. There's another one coming up in just a second, which is really to understand what's the logic for putting in place old age pensions. So the question I'm asking is, we should the kind of statement is we should provide social protection to older people as they are poorer than other generations. Is that a good reason? I want you to think about, do you agree with that statement or do you disagree with that statement? Okay, so we have the thoughts coming in. We've noticed that the problem of you being able to see the responses coming in is we see that gradually there seems to be people following one answer or the other. The reality is that with this question, there is no right answer. It's trying to get a little bit of the perceptions to kick off the thinking in the presentation. Okay, maybe just to go beyond the interactive system, is anyone who answered no to this question would like to, well, firstly, anyone who answered yes to this question would like to volunteer why, just to say a couple of words about why they did. Any eager volunteers? Yes, excellent.
For me, I think they're more vulnerable since they don't have an income that will be coming.
Brilliant. Okay, and somebody who said no. Oh, wow. There's a lot of enthusiasm amongst the no's.
For me, it's not about being poor that we should provide social protection to older people. It's about basically the way we treat people in society. It's not about poverty, it's not about being wealthy, because there are several aspects of it. Vulnerability, we are all fragile. Tomorrow, either you or me, you can be disabled. You can lose your job. It has nothing to do with poverty. It's about treating people rightly, welfare states.
Excellent, fantastic. Well, as I said, there's no right answer to that question, and I personally would agree with both. But I think if we move to the, I have control of the slides. That's it. Yeah. Great. Yeah. If we move to this slide, the reason I asked that is because this is a kind of common thing that I think we hear when in the discussions about social protection and the kind of life cycle social protection systems in many countries, that, well, we're going to give social protection to those people because they're poor, because they're more vulnerable, because they're poorer. And there's some truth to that, as I say. I agree with that. The danger a little bit is then we get into this endless list of different groups, and we all start competing, and those like me who've worked a lot on issues of old age pensions say, oh no, but older people are the poorest, and those who work more on the outside of children say, no, children are the poorest, and we all have a competition, and which I think misses the point. And I want to unpack a bit in this presentation, a little bit why it misses the point, and why it's more, I think, as the colleague here said, we need to think more about risks and tackling risks rather than just targeting specific groups. So the first reason why I think this is a slightly limited way of looking at the issue of old age is because there's a lot of diversity amongst older people, as with any of the groups that we've discussed today. And this is just one chart which shows some of that diversity. This simply shows employment, levels of employment, the proportion of each age group in the population that is employed, according to labour force survey statistics, by age group, and for men and for women. And what we see is, as in most countries, if you look at this data, there's a clear drop in the levels of employment in old age. As I'm going to explain, that's in a sense what we're kind of trying to deal with when we set up pension systems, social protection systems in old age. However, there's also a huge amount of diversity. I mean, one is by sex. We see levels of employment are higher amongst men than women, very much linked to the points that Maxine was discussing a few moments ago. But similarly, amongst older people, and this is data from the Philippines, by the way, and this is a country where the retirement age is officially around 60. We see a huge diversity. If you're an older male, age 60 to 64, then likelihood is, 7 out of 10 are still working, still employed. You look at those in their late 70s, 80s, it's a handful, it's a much smaller proportion. So within that kind of group of older persons, there's a huge diversity in terms of age and in terms of sex. We also see a real diversity in terms of the kind of socioeconomic status, the kind of work people have done throughout their lives. And this is just looking at one dimension of employment. This is some data. And the Philippines, we could have picked any country. I'm just using this as a case study. We still see real differences in those kind of patterns of work according to the area of work. So in terms of work in government, for example, unsurprisingly, there's a very strong link between levels of employment and age. At age 60, 65, very sharp decrease in levels of employment. Very few older people are working in government because of the formal nature of that employment and the very, strict retirement ages. You look at the other end of the scale in terms of self-employment, it doesn't look like there's much of a retirement age happening there, which is because most of these people aren't covered by formal social security. They have to continue to work in old age. So we could talk a lot about a lot of those dynamics in more detail, but I just wanted to highlight this first point. Older people, as with any other group, have a huge amount of diversity within them along a vast range of dimensions. The second thing which I'm going to unpack a little bit more is that vulnerability in old age is very strongly intertwined with how older people relate to their households and how they relate to their families. And I don't think you can fully understand the logic for something like a pension system unless you're really understanding that link to the family. And where I want to kind of take that is to highlight on that basis, we need to understand that pension systems have an impact on people of all ages. We could say similar things for child benefits, for disability grants. They don't just affect the recipients. And all of this has implications for how we think about social protection policy in general. But let's drill down a little bit about what I mean about that link to the family. And I want to kind of unpack a little bit the logic for social protection in old age. So if we strip it back to a basic level, the reason we have social protection in old age is to do with two basic factors, more or less, which is that people have less income at an individual level. They have reduced capacity to earn. Not no capacity to earn, but it's harder. I think within reason, it's different between different individuals, but it's harder to earn a living as we grow older, primarily linked to issues of disability, also to discrimination within the labour market. And associated also with that kind of disability, ill health, people have higher expenditures. So the kind of fundamental economic issue are those two things. But, as I say, we shouldn't see older people in isolation from the families and societies that they live within. So, just to highlight, older people, as really any people, live in most cases within quite complex kind of household, family, kinship structures. They may live with certain family members, but it's also likely that they, as parents, as grandparents, they have quite strong relationships to people they don't live with. Maybe people who live in another household in the same village, maybe people who live in another town, for example. Now, how does this issue of that kind of lack of income, increased health costs, how does that play out within the family? Well, in absence of social protection, then in a sense, the assumption is that extra cost or that reduced income, that essentially it's the family that has to take that on. It's that network that has to make up the gap. And in general, though the data is a little bit patchy, I think we'd say that in places where social protection is limited, older people are net recipients in general of support financial support from families and children. Now, the issues of that are there are at least three issues. One, as Maxine was discussing, and I quite like the term, she was talking a lot about unequal power and status within households and families. A lot of families may wish to support their older parents, but the level of support may often be limited, not least because a lot of the families we're concerned about are often poor and vulnerable themselves, and may face challenges in meeting a whole range of needs, let alone the expenses of older persons. Now, another issue is from the other direction, that even if a household is non-poor, has sufficient income, even if a family has the resources, there's a real issue concerning the kind of self-esteem and dignity of older persons in terms of whether they want to take that income and the extent to which they wish to be beneficiaries of that income. People who've been adults, who are adults, who've been breadwinners throughout their lives, who've been heads of families, to suddenly be a position where they're dependent on their children. I think when you look at the evidence, for very few people is that a very dignified status, to be dependent on one's children for one's existence. And yeah, where that support is there, I think it's important looking at it from the other direction that does place something of a strain on those wider households where a family is supporting its older parents with additional costs. That's an extra cost to those households. And just to show I'm not making up some of these statistics, I think this is some data from a report that we did in 5 Asian countries that highlights, I guess, the nature of the interlinkages of older people with their family, that we shouldn't see them in isolation. Most older people live with children or grandchildren, and many more. We found that in Thailand and Vietnam, 9 in 10 older person either living with a child or have one living in their community. So those relations are very strong. And a large proportion of children, of older people in both Vietnam and Thailand received income. So, this logic that we're just concerned with old age social protection because older people are abandoned by their families, not quite as simple. Now, whether that income is sufficient is another question. I think there are clear limitations. So what happens when, say, a pension system is put in place? Now, what you find is the presence of pension income changes that whole dynamic and transforms, if the benefit is sufficient, older people from being net recipients, being dependent on family members, to being net contributors. And that has, I think, 2 main impacts that I emphasize. One, it can significantly change the status and kind of empowerment of older people within that family, even with a relatively small benefit, and I'll come back to that. And similarly, considering that older people are part of those family networks, it's unsurprising that much of that income will then filter down to those wider families. So that's a little bit the kind of status, the kind of trying to unpack the situation of older people, the kind of context of old age. Now I want to move on to a little bit of evidence about, so in that context, what do we see in terms of the impacts of pensions on older people and their families? But before doing that, I just wanted to highlight that. And I have to show a video. I'll probably, best I do it, because I have to time it quite precisely. But I just wanted to highlight that there, as Christina pointed to this morning, there's been quite a significant investment in a number of countries in expanding the coverage of pension systems in the last 10 to 20 years. And it's that kind of investment that I think provides a lot of the data, which I'm going to talk about in just a minute. But just to give an example of that, and this only gives one kind of perspective on pension systems, but basically what this little video I'm going to show you shows you is how over the last 30 years in particular, more and more countries have put in place tax-financed, non-contributory social pensions, which is something I think many of the people in this room are more working on the side of the contributory system, which has been established, I think, in many countries for much longer historically, but this video is going to show a little bit about social pensions. So those are the non-contributory ones, which are more focused on people living in poverty. But if we just play it, I mean, the basic point here is when the video goes back to the late 19th century and shows when different countries put in place a social pension. And so you can see it going through the 20th century, and I'm now going to very precisely stop. Well, that's a little bit late, but that'll do. In about, 1990, okay. So what you see is 1990, so less than 30 years ago, a number of countries throughout the world have put in place these kind of tax-financed social pension schemes, but they were still a relatively rare occurrence around the world. Most of Latin America, you don't see anything in place. Most of Asia, apart from Malaysia and Brunei, very little. Again, in Africa, apart from Egypt, South Africa, and Namibia, no country has a kind of non-contributory pension in place as such. Now, if you let the video just play until more or less up to the present day, you see that in the last 30 years there's been a real rapid expansion. So most Latin American countries now have some kind of social pension. Most across Asia do as well. And many countries in Africa have extended some kind of social pension. The countries in orange are those with kind of pilots or regional schemes. The ones in the kind of pinky color are where we don't know when they introduced them. So if you know, please tell us. Anyway, the point of this was just to show there's been that kind of increase in investment in social protection. This is just one dimension. It doesn't tell us anything about, say, contributory pensions, which have also had important impacts on expanding coverage in recent years. So what have some of these developments, this investment in recent years, told us? What have we learned from it? I'm just going to talk about two areas. One is what have been the impacts on individuals. Now, linking to the points I was making earlier, now, I think when we talk about the impacts of pensions, we tend to kind of rush to saying, well, this supports basic needs. It means people have got enough money to spend on food, on health. You know, that's true. But I think when the more that I worked on issues of social protection and old age pensions, and particularly when you read qualitative evidence, the thing that comes across so strongly is that the most profound effect that the introduction of one of these schemes has is really a kind of transformative effect in the position of older people within their households, going from a situation, as I say, of being dependent to one of being contributors again, you know, to the household, to the family. And so just a few statistical kind of indications of this. One is around, in Mexico, for example, they found that the scheme there had significantly increased the level of decision-making, the likelihood older people were to have a role in decision-making in household. Similarly, in the last few years, there's been a lot of evidence coming out from very independent studies showing how these schemes have reduced levels of depression significantly. And these are unrelated studies in Mexico, Peru, China, finding this. And much of this, I think, is linked to the kind of sentiment of this quote here, which is a Mexican social pensioner talking about how she used to be ashamed of asking for money. It's like the kind of thing you see a lot from the qualitative work of older people who don't have pension income. You know, well, I feel awkward. I feel ashamed of claiming, of trying to take money from the household pot. And that changing, you know, when they have pension income. And if there's one area of expenditure where I think pensions have a particularly profound income, it is health. Particularly because that's an individual expenditure of an older person. One of the things that's going to be harder for an older person to justify to their family or to themselves that they should spend money on, you know, their individual health expenses. And so we see quite a number of case studies in countries where we see increases in health expenditure and access to health as a result of pensions. But that's not hugely surprising, the previous slide. You know, we expect pensions to have an impact on older people, else we're kind of lost, aren't we? But less surprising, I mean, I don't think many countries have probably specifically designed pension schemes thinking that they would have impacts on children. However, some of them, given the way in which pension income dissipates throughout households and is shared by older people, and kind of takes the strain off wider households, you see these impacts. And here are just a few. In Bolivia, the pension impacting increasing levels of school enrollment in recipient households, reducing levels of child labor. The case study of South Africa, which is quite well known, is around the pension there, finding that the girls, particularly in households receiving pension income, were taller due to better nutrition. The pension systems historically, and also as seen in some of these more recent developments, can play a significant role in reducing inequality. For example, it's quite well established in most European countries, pension systems tend to be the most significant policy in terms of reducing inequality, not just in terms of social protection, but across the board. So they can have that wider redistributive effect. And also there's evidence that, as with really any cash transfer that boosts household income, they can, you know, boost livelihoods, they can boost rural development. So I'm really going to leave it there, but I just wanted to end summarizing I guess summarizing the lessons from that presentation, but also just pointing to some of the lessons that are more going to come out, I think, of the pension reform elective that I'm involved in. So what I tried to talk about here is emphasize, we shouldn't think of older people as just a vulnerable group. And in a sense, I think we probably shouldn't think of children or women or people with disabilities as a vulnerable group exclusively. While they have certain vulnerabilities, we need to understand how those vulnerabilities fit into a kind of family context. In a sense, here, I think what we're talking about is protecting families, protecting individuals and families and societies from a certain set of risks, rather than targeting certain groups that are somehow living on islands separate from each other. So as I say, this applies to other social protection policies. Now, I haven't talked at all about how you actually design a universal pension system, one that effectively protects people in old age, and that's a whole different topic, and that is the one that we're going to address in the elective. But I guess, going back to the first point I was talking about the diversity of older people and people in general, pension systems need to be able to adapt to a kind of diverse array of life paths, different careers, different, people who've had higher incomes, who've had lower incomes. And of course, they need to combine, any effective pension system will have to combine contributory elements and those kind of tax finance, non-contributory. What I would say is that over the last few years, I think it's become clear that if you really want to close the coverage gap that I think exists in many of the countries in this room, that the tax finance pensions are a kind of essential component. They're part of a bigger story, but without them, it's not going to be possible. Okay, so on that basis, I will pass back to Juan. So thank you very much.
Thank you. Thank you, Charles, and thank you to everybody who has intervened today. We will have Ideas 42. We will have a break, but I wanted to recap on these 3 presentations, 3 very enlightening presentations. So we have said that we wanted to put research at the service of social protection. And there were very specific objectives for this session. One of those is to expose you and everybody who's looking at us online to the state of the art of social protection, to the people that are shaping the agenda. Second, we want you to directly engage with these speakers, these people that are developing this research, to kind of confront their realities and the issues that you are living in your day-to-day work in your countries. We also want that this research equips you and the people who are watching us to have better influencing, better capacity to advocate for children, adolescents, the elderly, and of course, women and men. And of course, we have seen, as a last point, that there is a disconnection between research circles and academic circles with those that are taking the decisions and are in the field implementing the programs. So I think that this space has created that bridge, that very much needed bridge to make a difference for social protection and achieve the SDGs, of course. So we've had already 3 of our presenters, and we've seen how we have unpacked social protection from birth, childhood, and adolescence with UNICEF. Now with UCL, we've seen an adulthood and working age, focusing on women. And now with Charles Knox and the ITC-ILO, we've seen the old age. Yes. And then the 3 questions with which I want you to go and have this coffee and reflect are the questions that were posed to our panelists. First, what are the specific issues, risks, and vulnerabilities confronted by the specific population group that you have focused your work on? Second, how does social protection respond to the issues, risks, and vulnerabilities of that specific population group? And thirdly, which is what we want you to take home, is what recommendations and actions can you take from their research, from their expertise, that can be taken by you to formulate, implement, and redesign social protection interventions to ensure their responsiveness to the issues that the population groups of your interest are confronting. What are the issues, risks, and vulnerabilities confronted by your country, basically. So without further ado, we want you to go back, take a coffee, reflect on this, reflect on the research, what has been presented. We will have a very brief session of questions and answers, so you can start already. For you who are present here, use the Slido, think and discuss with other people. We will congregate them and respond them. Tia will connect from New York, and we'll have the questions that are being put by the web. And additionally, we will have very interesting research that, last but not least, will surely make this even more interactive and interesting for you. Many things, and we have 15 minutes break since we've gone overboard. I hope you apologize. You know, you will make the time very fast, okay? Thank you very much. 15 minutes, please. Yes, oh, totally. I'm going to talk to him. He cannot take longer.
No, it's fine, but we don't do the questions.
Yeah, we will just congregate them in the Slido. We said we would have 15 minutes. That's why I asked if we could go over 5.
No, but we start with a question or we start
No,
with...
we will do Josh.
Perfect.
And then we will
Excellent.
congregate the questions. That's what I was doing.
Start this way.
Yes, absolutely. Okay. Josh? 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 How are you? Good?
Good?
Sorry for disturbing you.
You're not. I'm here for that.
Okay. Just want to ask you about the exam.
Yeah.
For if we need certification about the program, is it important to do it or?
Oh, yeah.
Yeah.
Yeah,
Okay.
it is.
Yeah.
I would say it's a little mandatory to
Yeah.
run the exam.
Yeah. But I know in all the courses it's or
Basically, the exams will be only about the elective courses that you're following. So let's assume that you pick course number 1
Yeah.
from Tuesday to Thursday. So you will have those 3 days of learning, and then on Thursday and the final bit of that elective, you will have to do the exam. It's 10 questions, multiple answers. It's easy.
Yeah, I know.
You could relax.
Yeah. Because
But you will have like 2 exams week number 1.
Yeah.
And you will also have 2 exams in like on the other week.
Two exams.
2 exams. So the next exams will be on Wednesday.
Okay. Because there is many information, many details.
No, I know.
And some.
You don't have exams about the planning sessions.
Okay.
Right? It doesn't mean you cannot learn this.
Yeah, I know.
But there's no exams about like the planning session because there's so much out there. Right?
Yeah, and also there is new information. You can.
No, there's no exams about those stuff.
Okay. Good.
So you could actually, in terms of exam preparation, you could emphasize on the elective courses that you will be following.
Okay. And we
Which
can.
are starting tomorrow.
Yeah. From tomorrow.
From tomorrow.
Okay. And also we have subjects to read it all in the e-campus.
Everything on the campus.
Yeah.
Come in there and then your resource person will give you more details.
Okay. Good.
Good?
Okay.
Are you ready to go?
Okay. Thank you so much.
Thank you so much.
You're welcome.
Yes, you can send them. You can download them and you can. Yes, I will show you. Do you have access to the campus? Okay. In WhatsApp. Okay, I will definitely help you to show you how you do that. Okay, after the whole break. But go and have a coffee real fast. Okay?
Hello. Can I help you?
No, because when Waza and I we were chatting yesterday. My Sunday.
That's good. Sunday is a good moment to chat. How's life?
Interesting in Waza weekend.
Good. All right.
So I'm sorry we couldn't meet yesterday. I was trying to organize a lot of things. So in Waza, come here and tell me.
Come here if you want.
Because your dreams will come true. Oh, very nice to meet you. Thank you. Wait. So, hello, welcome back from the break. May I have your attention, please? Okay, so finally, we've explored, we've unpacked social protection across the life cycle. Please wear your headphones for translation. So we've been able thus far to, through the research of quite notable people and organizations, we've been able to unpack social protection across the life cycle. And we couldn't resist the opportunity to bring you from the United States and a very interesting organization that is called Ideas 42, a think tank, which has been questioning whether behavioral science, which is quite new, it's still in the process of development, can be applied in cash transfer or social protection programming. So without further ado, I would like to introduce you to Josh Martin. And I would suggest before we give him the floor that you are with your iPads because we're going to do a very interesting test about your way of rationalizing, our way of rationalizing. So Josh, thank you.
Is it just this mic?
Yes.
Okay, all right.
And then I'll give you the
Is there a handheld mic? Okay. I want to be like Charles. I want to pace around.
It works. It's actually weird. It's this.
Oh, it's that.
Yeah, it seems to be working. Good.
So I roll it?
You have to kind of roll it. Yeah.
I roll it.
Pull it downwards.
I see. Okay. All right, let's see how that goes. Okay. All right. Hello. How's this? Yeah? All right. OK, je vais parler en anglais. Mais si vous avez des questions, vous pouvez aussi quand même poser des questions en français à la fin. Je vous invite. Just kidding. Going to talk in English. Just trying to see if you're awake. OK, so this is I'm told that this is an academy. And in any academy, there are tests. So we're going to start with the test. I know they said the quantitative portion wouldn't be till later in the week, but we're going to do some quantitative work right now. So what I'm going to ask you to do is to take up your iPads. I think we have this programmed in under question 1. So if you check out question 1, you should be able to give me your answers, okay? So let me read the question out loud. I'm going to give you guys a few seconds to respond. So, and these are easy, by the way. You guys will get this. You're international experts in social protection. This shouldn't be any problem to you guys. So, a cup and a saucer cost €0.10 in total. The cup costs €1 more than the saucer, so how much does the saucer cost? Put it in the iPads. Put it in the iPads. Don't yell it out. Okay, go ahead. Put it in. Oh, there's no question on the iPads? It just says question 1. It should say question 1. Yeah? Do we all have it on the iPads? Okay. If you don't have it in front of you, that's fine. You can just write down your answer. That's also fine. All right, question 2. So, if it takes 5 machines, 5 minutes, to make 5 widgets, how long will it take 100 machines to make 100 widgets? Go ahead. Write it down. Or put it in the iPad, whatever you have in front of you. Okay. I'll give you a couple more seconds on question 2. All right, question 3. Last question. So now you have a pond. There's a patch of lily pads in this pond, and every day the patch doubles in size. So if it takes 24 days for the patch to cover the entire pond, how many days would it take for the patch to cover half the pond? Go ahead, give it your best shot. Okay, while you guys are meditating on those and finalizing your answers, I want to talk to you about this. So we all have an incredible machine between our ears, okay? And it is a machine. It takes inputs, it produces outputs, and yet it has evolved over millions of years to do certain tasks extremely well, right? I mean, you guys looked at those questions, you said, those are easy, I got these, right? But it's evolved to do certain things well, but other things perhaps not quite as well, right? And so why don't we find out what those are? So let's go to the answers of the quiz. Actually, can we pull up, oh, we have to do this question by question, don't we? Just like all machines, some things work well, other things not as well. All right. So question 1 was about the cup and the saucer, right? So raise your hand if you said 10 cents. A lot of you are lying. The correct answer is 5 cents. 5 cents. Why 5 cents? Man, who wants to explain it to us? Okay, think it through. So let's say the saucer costs the cup costs €1 more than the saucer, right? So if it was, wait, what's going on here? No, it doesn't matter. Just leave it here. So the cup costs €1 more than the saucer, all right? So if the saucer costs 10 cents, right? Right, exactly. So 5 cents, if you add, you have to add, you have to add one, if it's 5 cents, you add €1 and 5 cents to 5 cents, you get €1 and 10 cents, okay? Now I know that you guys are smart, and if you guys think that through, I'm sure you would get it, right? But our brain is programmed to process that question in a very certain way. Same with the next question. Can we move on? Okay, so this is about the widgets, right? So most people said 100, however, 5 minutes to produce 5 widgets. So how many minutes does it take to produce 1 widget? 5, right? So you have 100 machines now producing those widgets. So how many minutes does it take? Still 5, because you have the same number of machines producing the same number of widgets, right? Again, our brains are programmed to think of this in a very different way. Let's go ahead. Same with the last one. So the pond takes 24 days to fill, the lily pad takes 24 days to fill the whole pond. It doubles in size every day. So let me ask you a question. On the 23rd day, how much of the pond does it fill? Half, right? So the answer is 23. But we're very tempted to look at that and say 12. So I'm not just trying to fool you guys. I'm trying to make a point. The point is that when we look at certain problems, our brain takes shortcuts. It goes right to the answer that seems the one that it comes up with most quickly, not the one that if we took a second to step back and think about it, we'd in fact come up with. Now, how is this relevant to anything we've talked about today? Well, let me give you a couple other examples of how our brain does this first. So often it can be very difficult to separate. So it's not just about number problems, right? It's also about how do we make decisions and actions in everyday life? So it's actually quite difficult to look at these people who are climbing this escalator on the way to the gym and determine from this what their true intentions were. Did they want to get exercise that day or not? Similarly, these kids, do they want to play or do they want to put themselves in danger, right? They have all the information they should need to make that decision. Same with these people, right? So whoever this is, might as well have been me. Also, do they want to lose weight or not? Do they want to get fitter or not? Right? It's very difficult to determine. And of course, something we do every day, in fact, I did this morning when I woke up with all the jet lag that I had coming from the US, is you set your alarm for a certain time. So you're declaring an intention to wake up at a certain moment or to do a certain thing at a certain moment, and yet almost all of us will not fulfill that intention, right? So what do we actually want? It's very difficult to separate motivations from the outcomes that our actions produce. Again, why is this relevant? Well, these aren't just trivial examples from everyday life. It turns out that the many people around the world who would have access to important benefits that they deserve don't get those benefits, not because they don't want them or because they don't need them, but because you fill in the blank, right? So in the US, we have a program that provides people with subsidies for attending college. The benefits of attending college far outweigh the costs if you calculate it in rational terms. And the subsidies we have in place cover that cost entirely anyway. So the incentives are clear. And yet still 30% of people who are eligible for this program never even fill out the form. So why? Well, one explanation is that when we think about behavior, often what we assume is that the decisions that we take, whether we want something or not, lead directly to the actions that we need to take to fulfill those. And then, of course, if we take that action, we get the result, right? We assume that if benefits are greater than the costs, then it's a decision that we will make. We are rational creatures, after all. But in reality, it's a little bit more like this. So we might want something, we might even know what we have to do to get it, but that doesn't mean that we're going to be able to take that path and pursue it all the way to the end. At some point, we might ask ourselves, will it take a long time? Will it be annoying? Am I in the right mood, right? Lots of things might get in the way that might frustrate us from pursuing that path. And behavioral science as a discipline has evolved really over the last 10 to 15 years to help us explain why these things happen. Okay, so it's not that we don't have the financial incentives. It's not that we don't have the information that we need necessarily. Sometimes all those things are true. But often it's because there's something about the way that our brain interacts with the context in which we make certain decisions and actions that prevents us from reaching where we want to get to. So people are complicated in very simple terms. That doesn't mean we're irrational, but that does mean that we can sometimes be counterintuitive or difficult to understand. And so what comes out of this literature, of this science, is that these small contextual details that often at first glance don't seem to matter at all end up making a huge difference to the outcomes that we find. And the applied side of this is these are not just interesting findings or tidbits that are just funny to look at or interesting to contemplate. These have real policy value. Because if you can design services and programs to take advantage of what we know about the brain and how it functions, you can achieve much higher impact than you're currently achieving at little, if any, additional cost. I mean, these are small tweaks that mean almost nothing in terms of added cost for a program. So this is really an important discipline to keep in mind when designing any social service. So that's the sort of work that we do at Ideas 42. We design these additional tweaks to the way programs work to make them more accessible, more impactful, more cost-effective. We do this all around the world. I'm not going to go into examples now. We have limited time. But I want to bring this now back to social protection, and in particular, like Maxine mentioned and others have mentioned, cash transfers are going to be a big piece of the discussion here, particularly for the developing world. Why do we care about cash transfer programs? Well, they impact a huge number of people, including in most of the countries where you all are from. There's also this opportunity to innovate, which is particularly interesting in cash transfers because there's pressure on programs that are expensive to deliver more impact per dollar that you spend on them. And that's particularly true in sub-Saharan Africa, where public resources are limited, and we have to squeeze as much impact as we can get out of these programs in order to make them as widespread as possible. And yet there's something about these cash programs, really any social protection program, that depends not just on the money that we give, but on how we give that money, and on the decisions and actions that the cash encourages us as beneficiaries to make with it. It's not just about the program, it's about how people interact with that program that ultimately matters. So what I would like to do is to encourage you to shift the focus a little bit. We've talked about some really great program factors here so far. We've talked about who you give the money to. Do you give it to elderly people, for example? Do you give it to adolescents? All that is critically important. We've touched a little bit on technology as well. I know that you guys are going to get more into that as the week goes on, and other innovations in how cash transfers are targeted or designed. But what we haven't talked about as much yet is exactly how do these people make decisions using this money? Because if we just give them the money and we don't think about that, we're sending them out with less preparation than they might need to be able to achieve their goals and make the program impactful. So how can we reduce what we consider to be the mental burden that these people face is by being poor, using this money and allow them to make decisions and take actions that have sticking power, that can stay, that can improve their lives, that can transform their situation. Let me go into this a little bit in detail so you can see how this works. So we give cash, right? Any economist can tell you when you give someone cash, it raises their income. That allows them to do things with it with their income they wouldn't have been able to do before. They can buy stuff, for example. They can substitute work hours, for example, for leisure hours. They can spend more time with their children. They can increase the diversity of their household food intake. All those are important things that they could do. There's also an empowering effect of cash. We talked a little bit about that in a gender context and an intra-household context, although of course the impacts are somewhat ambiguous at times. And the assumption here is that all of that leads to behavior. And of course that's true in many cases. On the other hand, cash programs, and in fact all social protection programs, one of the main margins of innovation here is on what we might call accompanying measures, or Tia talked about a little bit as cash plus initiatives. So they might be trainings, it might be messaging that's done around a cash transfer program or around a social protection program. Right? We're trying to teach people things, we're trying to give them information, we want to give them skills sometimes. So all that's really important, all that can also produce shifts in behavior. But now let's think about how each of these pathways work. So if I'm a beneficiary and you're giving me cash, in order to do anything with that cash, I have to make some sort of plan. I have to set aside that cash, and I have to prevent myself from doing anything else that doesn't conform to my plan, right? I have to not spend the cash on things that aren't helping me achieve my goal. That's pretty hard. And even on the accompanying measures pathways, we have these bottlenecks. So if there's a training event, I have to come to it, right? I have to pay attention. I have to figure out what actions I want to take after that training event, and then I have to pursue those things and keep pursuing them and not allow myself to go off the rails on that. So what's the role of behavioral science here? The role of behavioral science is to identify each of those moments where you can make a decision or make an action that might take you off the path that you're supposed to be on, that you want to be on, and reinforce that moment so that you can make a better decision or take a better action that gives you a better chance of fulfilling the pathway to the end. So one experiment I'd like to tell you about from science was done with sugarcane farmers in India, where they essentially did an intelligence test with these people. Okay, so they had a number of math problems similar to the ones I just gave you a little while ago. And they measured how these farmers did before the harvest and after the harvest on these math problems. And what they found is that pre-harvest, there were a lot of errors. They made a lot of mistakes, just like you guys made, even though you guys are after lunch. So I don't know what to think about that. And yet after the harvest, they made a lot fewer errors. Okay, so why might that be? Remember, these are the same people. Well, it turns out that poverty reduces your ability to concentrate. This is a finding which has been replicated in many contexts. So it's much harder to focus on something, to do what you might call a high cognitive load task when you're in a situation of need, when you have other things to think about, right? We know that people in poverty have needs from moment to moment, from day to day, from week to week, that if you're trying to now talk to them about what they're going to do with some money they're going to receive in 2 months, 4 months from that point, of course they're not going to be able to think about that. And if they do give you an answer, they're probably not going to remember it. They're probably not going to stick to it. So this matters a lot when we think about who the beneficiaries of cash transfer programs are, or any social protection program, right? We're talking about the most vulnerable people in the world. So when we implicitly ask them to set realistic goals, to plan for the long term, to sacrifice needs now for needs later, to resist the social pressure that their family puts on them, to put the money towards one use or another, to remember what they wanted to do with it and to follow through on that. All these things take a lot of concentration, a lot of focus, right? And we're not putting them in a good position to do that unless we're really thinking about how the program can support them. So how can the program support them? Well, the field is just beginning to look at this question. There's a number of studies that have come out recently, some of them by Ideas 42, others of them by our colleagues in academia, our advisors, that are beginning to test ways of reinforcing social protection programs to improve the way that we make decisions and make actions with the money we receive, with the support that we receive. So I want to tell you about one of them, but first I want to give you an insight into how, given that this is a panel on applying science to practice, I want to give you a quick insight into how we do that at Ideas 42, so that you guys can also feel confident that when you go back to your countries, there's a method, there's a way that you can adopt that would allow you also to take some of these insights and put them into practice. Because every context is different, every country is different, every set of beneficiaries is different. So you can't just take something that works in one place and use it somewhere else. You have to design it and contextualize it and adapt it and customize it, right? So this is the process that allows us to do that. The first thing we do is we define a problem. So we identify a behavior. What is the decision or action that needs reinforcement in this context? Is it attending a training event? Is it using the money to support savings? Is it using those savings towards a productive goal that they've set for themselves. What is the action that we need to support these people to do? Then you have to study the context in which they're making that decision or taking that action, all right? If it's about savings, where do they decide to save? What are their options for saving, and when do they consider those options? Does it happen outside? Does it happen with family members in their presence? Does it happen at a certain time of the day or of the week or of the year? And then you have to think about the design. So how do we design the way that we're paying people or the mechanisms of the program to take those things into account specifically? And then we have to test those things. So it's not good enough to just say we've come up with a really innovative way of doing something. We have to make sure that it works. We have to identify the policy value that that thing provides. So we have to run some sort of test. And then of course we want to scale the things that work and adapt or refine the things that don't work, or perhaps drop them entirely, right? We're trying to use evidence to further our practice and make our programs better. So let me give you an example from a project that we've been working on in Madagascar. And here the issue was that these beneficiaries were being given money. This is a productive safety net context. So the beneficiaries themselves had even said that they want to spend the money on buying more productive assets, right? And yet, they weren't able to save up enough of their regular transfers. Now you can look at that and say, well, maybe they weren't receiving enough, right? Maybe the size of the transfer is too small. Well, maybe, okay? But actually, if you add up all of these payments that they're receiving, you do get to something like the cost of what one of these productive assets would be. So imagine that's a cow, okay, or a sheep, or something like that. There is enough money here to be able to afford that in some way. Now, maybe it's not as much as it could be, okay, but there's enough money at some level to be able to afford that thing. And yet they weren't doing it. So now you have to look at the context. So when might they be deciding to put that money aside? What might be getting in the way? Well, again, these are some of the most vulnerable people in the world. So that we know that they're living in scarcity. We know that they're living in a context that's going to make it difficult for them to concentrate. So that's one thing we know. Also, the program is called the Family Survival Program. So how might that impact? How might that impact their decision to save? Any ideas? The program is called the Family Survival Program. Sorry? Right, so it gives them this message that this is about survival, right? And people that are thinking about survival are not thinking about the future. They're not thinking about saving up to buy a long-term productive asset. So there's a framing issue with the program itself, the way the program is messaged, that might be making a difference to what people are doing. And then one thing is that they all are coming together on the village, at the village market on the transfer day. I mean, the program has to pay people somewhere, and why not pay people where they already are, which is often at the market. So of course, they're going to pay people in the presence of lots of other people. So what does that do for their spending? Well, it turns out that saving is a very private activity. Okay, if I'm going to save my money, I'm doing that at home. I'm not usually doing that where lots of other people are around. But spending happens in public. And at a market, spending happens all around you. And one thing that we know from science is that I'm much more likely to do what I see other people around me doing, okay, than I am something that I myself want to do that I don't see other people around me doing. We call that a social norm. And so one hypothesis here is that people are spending because they see everybody around them spending, especially at the moment when they receive the money. So what did we do to mitigate these factors? Well, one thing we did was we put this poster up next to the transfer centers. And what this does is simply give people an idea of what other people like them are doing with the money. So we have some examples here. We have pictures of people thinking about certain things. And this is a low literacy context, so it's not as if these people could read these examples had we put them in writing. We had to be very creative with the text and with the visuals. So people are looking at this and they're examining it and they're thinking, what if I were to think of those things? Or what if this person's doing it, why can't I do it, right? So we're planting a seed in their mind here. So that's step one. Step two is to give them a goal-setting activity. So we put this sheet of paper in front of them that has different goals that they could select on it, and we simply ask them to make an active choice. You say, here's a number of things you could do with your money. Which one would you want to do? So it's just giving them a moment that they don't already have, a dedicated moment to think about, what do I want to do with my money? And then they take that goal, these are stickers, and they take it from the sheet, and then they put it on a second little worksheet, which is inside their beneficiary booklet, okay? And so they take the goal and they put it somewhere that they're going to remember. They put it somewhere that they're going to be reminded of and encounter every day. And this is my favorite part. So here we actually do an accounting exercise with these people in which we have them circle the amount of money that it's going to cost to buy that thing. So in this case, this person puts school expenses down as their goal. And so now they have to decide how much money is it going to cost? How much money do I need to save up to be able to afford those school expenses? And then they can cross off, as they're able to put that money aside, they can cross off the amount of money that they're saving. So that way they can track their progress. And they're reminded of this goal constantly. And they have some way of keeping it in their mind without having to concentrate too hard. And then last, we actually give them a way to put that money aside so that they can separate it from the rest of the cash that they spend on regular consumption. So this is a phenomenon that we call mental accounting or partitioning, where if you create a separate mental account for different pools of spending, you're much more likely to spend that money according to those goals. So rather than just keeping all your money in one wallet, where who knows what it'll go to, if you actually have different wallets or different physical separations of cash, then you're much more likely to spend that money according to where you put the cash, right? So simply, this is just a very simple idea. These are little burlap pouches. You can see somebody there putting the money in there. So again, the testing piece. It's important to know whether this works. So how do we do that? I won't go into detail, but the idea is you start small and you get bigger over time. You test progressively more rigorously as time goes on. And the very first thing is we prototype. We ask people what they think about this. We get them to react to it and respond. We make adjustments. We do some user testing. This is all still very qualitative. This is focus groups. This is interviews. This is practice sessions. And we continue to refine. And then ultimately, we do a proof of concept test in which we roll it out. Some people get it. Some people don't. We compare outcomes. We see how people do. And then we can do a full pilot, cluster randomized trial, academic standards of rigor, and understand whether it really works, and importantly, whether it works relative to the amount of money that we've spent on it so that we can scale it up even further. So let me give you the pilot results here. This is actually right now in a randomized control trial that we'll have the results of hopefully in a couple months. But the pilot trial shows a 40 percentage point increase in savings. Okay, so that's a big deal. This is a difference in difference method. I mean, I'm happy to get into the details if anyone's curious. But basically what you have here is over time, people that get this package of interventions save at a much higher rate from their transfer funds than people who don't get it. And I mean, think about how much this costs. I mean, those things that I showed you, right? You're talking about a poster, a tiny burlap pouch, a couple of worksheets, and like 5 minutes of facilitator time, right? You're talking about like less than $1 per beneficiary on average, right? And think of the impact that you're producing on that $1. So we're working on getting this to scale. We're working in countries that a number of you are probably coming from, Kenya, Tanzania, and Ghana. We have other projects in Madagascar as well, and of course there's many other people around the world working on this. This is a very active area of innovation right now. The evidence is still limited, but is increasing day by day. Of course, we work on many other projects in many other fields as well. So this is, as a field, is continuing to expand throughout the world, and areas that also fit into social protection we're also working on. For example, Jessica's going to tell you tomorrow about pensions and retirement savings, as well as labor market programs we're working on using these methods. And of course, there's many other things as well. So I won't go too deeply into how we apply this even more practically than I did before, but just to give you a sense, we spend a lot of time really defining the problem. So this is just a question of, this is a graph of just how much time we spend on each of these phases, and to give you a sense. You've got to spend a ton of time looking at the problem itself. If you don't get the right problem, you won't get the right solution. You diagnose, you apply the science, you design, you iterate, you test, and that can take a while sometimes, and then you scale, and it's important to give it as much time as it needs to scale, because different things scale in different ways. So the example I showed you from Madagascar, that's as simple as the government adding this design to their social protection policy and allocating the funds to pay for it, and away we go. But there are other things that scale different ways. They scale through technology, they scale through the international community, for example. All of that can take time. All right, I want to leave you guys, because I know my time is up. I want to leave you guys with one last example about why context is important, and why it's important to examine assumptions, okay? I used to live in a West African country where I won't go into detail to avoid any undue embarrassment. But I have a fun example for you guys. This is from corruption. Okay, this is a very different domain. Forget social protection for a second. So the government wanted to reduce corruption. And so the government came out with this campaign. And it's a great campaign on the surface of it. I mean, really excellently and technically very well done. They had these bulletin boards all over the city, okay? And they said things like this. Now, for the Anglophones among us, this says, "It took away my wife." All right, so that's just one example. But it had lots of different themes like that all around. And then at some point, there was a big reveal, and it was made clear that this is actually about corruption, and it said, we have corrupted our institutions, it has ruined our country. So all these very negative messages about corruption were very prominently broadcast. You might say this is a real progressive campaign, a real step in the right direction. The country's acknowledging its issues and is taking proactive steps to sensitize the population, right? So good work. But what's being said? So who wants to call out to me what's being said about corruption? What's the message? Ideas? Huh? Sorry? En français, si vous voulez. What's being said? It's bad, right? C'est pas bon. C'est mauvais. Voilà, okay, so it's bad. Okay, that's message number one. Message number two is it's all around us. So it's everywhere, right? C'est partout. And if it's everywhere, that probably means everybody's doing it. So if everybody's doing it, what might that make me say? Right. So if everybody's doing it, maybe I should do it too, right? So you have this campaign which has the absolute best of intentions behind it and is technically very well executed, right? It's very professional. And yet they haven't examined the assumption of why this campaign is going to make the impact they want it to make. They wanted to reduce consumption, but they haven't thought about corruption. They haven't thought about whose corruption they wanted to reduce or what are the factors that motivate that behavior. And so if they looked into it and they thought about how one factor behind corruption is that you do it because you see everybody doing it, right? This campaign is only going to make that problem worse. And think about, back to social protection, think about the programs that we design and what we're thinking about when we design those programs. If we're not examining the assumptions that are behind why our programs are going to create a certain impact, probably there's lots of cases like this embedded within our programs as well. So it's worth thinking it through. It's worth examining those assumptions. And then the solutions don't have to be big and expensive. The solutions could be very quick. They could be very small. They could be almost costless at times. But they're there, and they do require examination. So anyway, I just want to thank you for your attention.
Okay, thank you very much. Now, what we're going to do is that we are going to get into the Slido. So remember how to connect Slido. We put the code that you have in the iPad, and you're going to think about a question that you want to direct to any of our speakers, to Tia in New York, to Josh, to Frank as well, who works with Tia, or to Maxine or Charles Knox. Or maybe something broader, something that you've thought about unpacking social protection across the life cycle. Maybe you want to focus in one specific stage, or you want to focus about the applicability of behavioral science into social protection programming. Now, I want you to get there. I want you to pose your question, and if you don't have precisely a question, Slido allows you to vote for that question that you think is the most relevant or important, instead of creating more and more questions. So what we're going to do is that we're going to select the best questions so that we can very briefly respond to them, okay? So we'll give you 2 minutes to think about that and get into the Slido. Thank you. Okay, right now, our question, the one that has been the most voted. Hello, Tia. Hello. Yeah, now we see you. It's considering the shrinking investment on social protection and the cash transfers have been donor dependent. Do you think it is realistic to introduce a new level? So that would be the first question. So you think about that. Tia, what do you think about that? Considering the shrinking investment on social protection and that CTs have been donor dependent, do you think it is realistic to introduce a new level? It's the one that has the 10, now 11 votes. And the second question, which we're going to pose to our speakers, is how can you make sure that cash transfers beneficiaries are not in perpetuity, are not put there forever? And third, which is very interesting and very much directed to Frank or to Tia, it's how can we incorporate adolescents in livelihood or cash plus programs? And in French, how should we select the beneficiaries of cash transfers? Under which criteria? So I think that with that we have enough. We have various questions that are extremely interesting. Thank you very much. And now the speakers have the possibility to respond to any of them, okay? So we go. Okay. So Tia, would you like starting with whichever question?
Sure. Can you hear me okay?
Yes, perfect.
Okay, great. These are great questions. And the one that I want to talk about is considering the shrinking investment. How do we think it's realistic to introduce a new level? So I'm not sure which presentation that was referring to, but I think it can also be asked about Cash Plus and integrated programming. So I think it's not about necessarily always adding a new level, but it can just be designing smarter. So cash alone can have positive impacts on spending, resiliency, food security, education, etc. But the idea is that by linking the beneficiaries to access other services such as healthcare or other information, then you can leverage and boost the impacts that the cash is having at the households. So it's not necessarily competing or adding more, but about linking to what is existing in communities, because we know that recipients of some of these cash transfer programs are often marginalized and excluded from their communities. So they may not be fully benefiting from those existing services. So if we can link to existing services, then we can really boost the impacts of the cash.
Okay.
And then I'd also like to acknowledge my colleague, Frank, who was also on the panel, as you mentioned. So maybe he would like to jump in.
Yes, that's exactly what we're doing. Frank, your thoughts? Thank you very much.
All right, thank you. And as you're saying, that space is shrinking. And for me, it depends on whether the countries view cash transfer as just a grant to the poor, or whether we begin to view it as an investment in the youth. So a part of it is, for me, it's an investment that we are making in this youth. If you look at the lifetime returns of educating them, keeping them safe until they transition into adulthood, and their potential returns when they begin to work and the taxes that they could pay back, then it's an investment that the state is trying to make rather than to leave them alone. So it depends on how we are looking at it, whether it's just a grant for them or whether we begin to view it as an investment that can also yield returns for the rest of the country.
Great. Thank you, Frank. Very good point. Now, Professor Molyneux, any question you would like to answer from the audience?
Well, since we're talking about investment and the problem of, using resources efficiently, it is indeed what Tia already said, it's not necessarily a case of having to add more, but to do what you're doing better. And that's clearly one of the kind of ways in which, maximizing efficiency becomes top of the agenda. So making programs better targeted, making them more inclusive where they really have to be, i.e. not by not neglecting or ignoring people who really have to be in the program. Reducing inefficiencies of that kind is one way to sustain programs through difficult periods where resources are limited. But of course, to tackle that problem of resources is a much bigger question. And of course, we come back to the issue of taxation. What is the tax base for sustaining programs that are effective? And I think that's a bigger conversation that governments are finding themselves obliged to have, particularly because these programs are absolutely essential to sustain, and people themselves will be demanding that they're sustained. It's very difficult to close down social protection programs once they're actually there, once people are in them, and the political costs of doing that are very high. So governments really have to think very hard about sustaining programs, how to make them work better. That would be and also to see the issue of investment in people as a social investment and a necessary one for the country as a whole.
I just add one quick thought to Tia's and Frank's point in particular about how programs are affordable really at any level of income. It's not, I would say, even if you don't take the long-term lens, I think that, well, just like Maxine was saying now, I mean, it depends on how the program is designed, right? And again, there are things that might seem to me not that important about these programs, but that could be quite important for getting more impact out of every dollar that you would spend on the program. And I think often it's assumed that technology is going to be the savior here by reducing the marginal costs of rolling the program out to the additional beneficiaries. And that may be true in many cases, but often we've seen technology just make things harder for beneficiaries, make things more complicated, it can make things harder for the people who distribute the cash as well, or who operate the program, the field staff. And so working on the design of the program itself, on the amount of cash, or on technology, or on the way that the cash program works is one margin, but there's a whole other margin that's often neglected when trying to make these programs more efficient, more impactful. And as I was saying before, I think there's lots of things that could be done. One very, very simple thing one can do, by the way, without thinking too hard about design features, is just changing the timing. So often there are programs where we think that if we pay people every 2 months, we're going to be able to support their consumption. Well, if you paid me my income every 2 months, okay, I wouldn't be able to use it to support my own consumption. And my consumption is many hundreds of times higher than most of these beneficiaries. So, if you want to support consumption, you have to pay people more frequently. Similarly, if you want to encourage longer-term investment, you have to pay people less frequently. I mean, there are things like this that really, really matter for putting people in the right position to make the decisions and actions we want them to make with the cash.
Yeah, maybe just to pick up on this question that I think was when do we stop needing cash transfers, or when are they no longer necessary? And I think that, I guess my perspective, while there may be, certain elements of a social protection system that may become less relevant, or maybe be able to kind of be redesigned or reformulated into something else, the reality is that likely most countries, particularly those that currently have very limited social protection, will be wanting to invest more in the future. I think there's, while the kind of the headline objective of things like the Millennium Development Goals and the SDGs are positive in focusing on issues such as the need to reduce extreme poverty, that's not the end goal. And if we were just trying to get rid of extreme poverty with social protection and then, great, we're done, then if we went to European countries, we'd find there was no social protection, we didn't need it anymore. Whereas it's quite the opposite, on average, I think OECD countries spend something like 12% of GDP on either contributory or non-contributory cash benefits. So it's a huge part of their economies. And, that's because while extreme poverty may gradually reduce, relative poverty is something far more structural. There are issues of inequality, social injustice, that even as an economy grows are going to be equally, if not more relevant. And really, I think this comes back to this logic of a life cycle system. We're not just trying to kind of find a lump of poverty that we can kind of cure and then it's no longer there. a lot of what social protection systems are trying to do is to address issues we know are always going to be real, those life cycle risks. People are going to get old. People are going to have disabilities. People are going to have accidents. People are going to get ill. People are going to face the challenges of raising a family. You know, that's what a social protection system is trying to address. And there are different ways in which the way it addresses it may change over time, but the issues that it's trying to address will not ever go away in a sense.
Okay, so I want you to join me giving a huge applause to Tia Palermo, Frank Ochere, Maxine Molyneux, Josh Martin, and Charles Vydmanov. Thank you very much for joining us, for making the time to be with us and share your research and your work. And now, without further ado, you can go and have a rest. Thank you. I hope this was very useful. Okay, bye.